started a few healthcare companies and been involved in a number of healthcare initiatives. I guess the first was Zocdoc, which is a company that I started in 2007 and ran for about a decade. Zocdoc helped people book doctor's appointments online. And one of my biggest regrets from that experience is that through Zocdoc, I was able to improve access to healthcare for people who already had healthcare coverage. But for those who didn't have healthcare coverage, there was very little that we could do. So I always told myself that I wanted to learn how I could help everyone. And the next healthcare company I started, I wanted to make sure it helped everyone. That led me to join the board of the public health school at Columbia University, where I've been actively involved, and to start my latest company called Doctor B. Doctor B is a telehealth platform to help people get access to everyday prescriptions. We've started with enabling people to get access to COVID antivirals, such as Paxlovid and Molnupiravir. And the challenge with these medications, as many of you are probably aware, is that people have to get these medications within 5 days of getting COVID, which means that the patient has to have had healthcare coverage. They had to have had a primary care doctor. The doctor had to have time to see them, and they have to hope that it wasn't a weekend. And all of those things make it incredibly challenging for many Americans to get access to these life-saving drugs. So what we do is we enable people to have an asynchronous consultation with a medical provider, generally in under 1 hour. And we then send the script for, if the patient is a candidate, to the appropriate pharmacy carrying that medication, and the patient get on their way for treatment. We do all of that for $15, which is less than the average copay. And if a patient cannot afford $15, we are the first telemedicine platform in the country that treats every patient regardless of their ability to pay. So we will actually provide the service at no cost to patients who financially qualify.
Okay. So it seems like you're ahead of the curve on this kind of stuff, because as far as, the technology to set up appointments online with Zocdoc, it is an amazing, and helpful service that's getting people who have the coverage and allowing them to get in to see the people, see their practitioners without a whole lot of fanfare and difficulty. So fantastic. I appreciate that. And yet here we're talking about Dr. B, and you're talking about asynchronous and yet timely within an hour service. Like, where do you come up with the ideas, or how is there a history on how you're kind of forward thinking within this arena?
I think that, to be honest, it was instilled in me very early in life. My mom really wanted me to be a doctor. And so she instilled in me the value of access to care. She would tell me it's really important that you become a doctor because it gives you great access to healthcare. And having great access to healthcare is the most important thing that we can have in our lives. And I remember I was 5 years old when she started telling me that. And I remember a year later, I learned that someone who I was very close with, who's almost like a second mother to me, didn't have healthcare coverage. I remember how worried I was for her. And so I think, though to my mother's dismay, I never became a physician, it did resonate with me, the improving access to healthcare. And so my superpowers are that of a technology founder. And so anytime I've encountered a problem of healthcare access, I've tried to solve it.
It's really interesting. We just had Andrea Van Hook, who is the executive director of RESNA, the Rehab Engineering Society of North America. They're all about assistive technology. And one of the things that she said is, you don't need to be an MD to be able to have a positive impact on the healthcare system. And I'm hearing you say something very similar. Does that resonate with you?
Absolutely. You just have to have passion for the problem, really.
Okay. And listen, I really feel the same way myself. I'm not an MD. I'm a patient. And my hope is to get the information, to gather perspectives on healthcare, to be able to take this information and to reflect it back to the healthcare community to say, here's what medical practitioners have to say, here is what patients have to say, and this is how you take all of the information and you can improve the healthcare system and ultimately improve the healthcare outcomes of patients and improve the lives of people living in the community. And I think it's an effort that we are all together working towards the same goal. So fantastic. In that vein, what does quality healthcare mean to you?
I think of quality on three dimensions. There's obviously having access, there's better outcomes, there's affordable, low cost. So traditionally, if you look at any of these three vectors, whenever a policymaker has tried to improve access or cost or outcomes, oftentimes it happens at the expense of one or more of the other two dimensions. And so one of the things I feel very passionate about is technology is really the only way that you can introduce new technologies that have the ability to impact all of those three dimensions of healthcare in a positive way. What do I mean by that? So if you take asynchronous telemedicine, a platform like Doctor B, for example, you're able to very efficiently interact with the patient, very efficiently interact with the provider, thereby having a very low cost. You're able to improve access because you can reliably offer up, people don't have to wait days or weeks to see a doctor. They can really wait minutes or hours. And you can improve outcomes by using technology to make sure that all the information that is available on the patient can be used in determining how the patient should be treated and making sure that that's done safely and in a consistent manner. So I think it's important that we look at the various facets of quality when we're going to define it.
I feel like sometimes the concept of accessibility and affordability can be confused, because people would say that if you don't have healthcare, then the cost of obtaining health coverage is prohibitive, and therefore it's not accessible to those who don't have the coverage. Can you talk a little bit more about the differentiation that you see between the concept of access and the concept of affordability?
Sure. So access, I view is can I get to the medical provider irrespective of cost? Can I get to my dermatologist? Can I get to my primary care doctor? There are states in this country where to see a primary care doctor in person have upwards of 60 days in order for that to be the case. And so regardless if you have money or not, you're gonna wait. And cost obviously is the other end of it, which if you're lucky enough that you have healthcare coverage, that's great. But even Americans who have healthcare coverage today, I don't think that the metric that we should be looking at is really the uninsured Americans, because there's many Americans now that have health insurance with high deductibles and they struggle to even make the deductible payment. Most of this country can't afford a $500 hit. And if these deductibles are $3,000, it's the reason why healthcare in America is the number one reason for bankruptcy. It's the reason why 2 in 5 families struggle with being able to afford healthcare, which is remarkable considering the fact that we spend 50% more of our per capita GDP on healthcare than any other country in the world.